Welcome back to 02 PMHNP. Today we will be going over CYP450 inhibitors and inducers. So what is CYP450? Well, they're a family of enzymes. The highest concentration is in your liver, but it's also in your kidneys and intestines. We're covering the main ones for psychiatry testing and boards, but you really should review Dirty Medicine's video for the inducers and inhibitors of most meds. So what's an inhibitor versus an inducer? So CYP450 inhibitors will increase the drug levels because they reduce the breakdown of drugs. They're inhibiting the breakdown. So therefore, it's going to lead to higher drug levels and the potential for side effects and toxicity. Whereas CYP inducers will decrease the drug levels because they're inducing or increasing the effectiveness of the CYP450 enzymes. So it's going to increase the breakdown of drugs, therefore leading to lower drug levels and potentially subtherapeutic effects of those drugs. So I know it's a little confusing because you're thinking inhibit down, but it's the breakdown. It's inhibiting the breakdown of the drug versus increasing the breakdown of the drug. So again, please review that Dirty Medicine video for the full breakdown of inducers and inhibitors, but here's our main ones for psychiatry, for practice and for testing. So a big one is Tegretol. So Tegretol will even induce its own self. So eventually Tegretol levels are going to have to be slowly increased over time because it's inducing its own metabolism. Another thing is nicotine, so cigarettes and vaping. Caffeine is specifically for 1A2, so it's not going to induce a ton of medications. Cocaine and phentoin and phenobarb. Then our main inhibitors, so grapefruit juice, antibiotics, antifungals, antiretrovirals. It is not every single one, but it's just a good rule of thumb. Many SSRIs, methadone, and cannabinol/cannabis, so the CBD part of the cannabis. So even if they're not smoking, if they're doing like CBD gummies or CBD oil at night to help them sleep, it can inhibit the CYP450 and therefore increasing drug levels. So let's do a little practice question. So your patient reports they quit smoking. So you know that their dose may need to be decreased. Their dose may need to be increased. You need to stop the medication or there's no need to adjust. So you might need to decrease the medication. So this one's a little tricky because we know that nicotine is an inducer. So you're going to need more medication while potentially more medication while someone's smoking. But if they stopped smoking, their drug levels may increase because it's no longer being induced. So you might need to decrease the drug. All right, let's do another one. Your patient reports taking CBD oil at night to help them sleep. You know that their dose may need to be decreased. Their dose may need to be increased. You need to stop the medication or no need to adjust. So their dose may need to be decreased because CBD, so the cannabinol and cannabis, is an inhibitor of CYP450. So it's going to reduce the metabolism of that drug. So the dose may need to be decreased. Okay, one last practice question. Your patient reports they started smoking again. Their dose may need to be decreased. Their dose may need to be increased. Stop the medication, no need to adjust. Their dose may need to be increased. So remember that nicotine is an inducer, so it's going to make the drug metabolize quicker. Therefore, their dose may need to be increased now that they've started smoking again. So let's do a quick review, and this would be a good page to print out if you're having trouble remembering all of this. the arrows always help me. So your inducers are going to increase the CYP450 activity. So they're inducing the CYP450. So that increased CYP450 is going to lead to decreased drug levels and therefore subtherapeutic effects. Whereas inhibitors inhibit the CYP450 activity. So low CYP450 will lead to increased drug levels and therefore risk of toxicity and side effects. Thanks so much for joining. I hope you found that helpful. Let me know if you want more practice questions during these reviews. Thanks.